Blockchain is essentially decentralized data, right? And it's probably one of the most secure ways that we can
Mm.
store and access data. And for me, the blockchain element comes into how patient stories and data are being collected. I strongly believe that the healthcare industry hoards data and are incentivized to do that. And I think that data should really be owned by the people who generate the data, which are
Mm.
the patients.
Okay, we're talking. Now we're talking.
Right. So for patients to own their data, though, they need the tools and mechanisms to do that. And blockchain is definitely one of the best out there. And with blockchain, patients can control how their data is being accessed, consent on who can access it. And what I also think is important is patients should be compensated on their data and information, because if it's being used to make decisions that are leading to revenue,
Mm.
then why aren't patients being compensated for it? Hello, everyone. I'm Sheila Phicil, social change futurist and founder of Phicil-Itate Change, and you're listening to the Public Health Insight Podcast.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
So strategically, you're able to kind of have your fingerprints on making sure that the solutions are being tailored to the actual specific needs that are unmet that maybe people just aren't as aware of because they don't involve those populations in the design and the different conversations. So I could see why you
Exactly.
got really excited about like being the hub to all of those, like from the government health fundings to the private side, and like you're at the intersection of all of that,
Yeah. Yeah.
which then led to something very special, you starting
Yes.
your LLC. Let's talk about
Yes.
that.
So, 4 months ago now, launched to Facilitate Change, my small business slash startup, and was not expecting to make this transition at this point in my life. But you
Mm.
know what? The universe, God has their own timing. What's nice about having this opportunity right now is I think that we're definitely in the age where there's a lot more tools available for us to
Mm.
innovate in healthcare,
Mhm.
AI being one of them. I think it has significantly unlocked opportunities that I think were probably not available before. I mean, healthcare generates so much data, and there's so much more opportunity for us to like deeply understand people's like lived experiences and symptoms and other things, right? And then we also are coming into, as you know, in America, a different administration that leans away from regulation, which might also benefit the healthcare space in terms of creating more room for disruption as well. So um, I think that what I hope to be able to give, and my core mission really is to help the helpers, the people who really do want to put good solutions out there and solve problems in healthcare, to help them do that successfully, right? And sustainably, and to do it with people at the center.
You mentioned still things are still fresh. Could you talk for what you're able to share? Talk a little bit more about sort of your business model right now, like the service offerings, how you engage with clients. I know we have a lot of people that listen that are of that business mindset and they want to know how to get started. But before I throw it to you, I always find it refreshing when we have these public health and healthcare leaders that experience a system and then go into consulting and then starting their own business, because then you're bringing things in, you're generating solutions based on firsthand experiences of seeing the gaps. Sometimes you have
Yes.
people who graduate after doing some schooling, not really much work experience, who want to get into consulting, and they miss that
Hmm.
wealth of experience that they could have got had they gone through more of that corporate pathway. Like everybody's journey is different, but I always think it's
Yeah.
rich. You can tell, I can always tell someone like that person's worked in the healthcare system or public health for a long time based on what they're now bringing to the table in their business. So I just wanted to
Yeah.
say there's something to be said about that. But yeah, tell us about Facilitate Change.
Yes. So, what my mission really is to really power social innovation, starting with the healthcare space, right? And what that means to me and what I really want to offer are advisory services that really guide organizations and teams on like how do you actually put out innovative solutions that really work well for people,
Mm-hmm.
and solving real problems along the way, right? And I have a very specific like framework or point of view
Mm-hmm.
around innovation, and you've heard some of that already,
Mm-hmm.
where I think it's very important to have like a clear understanding of the problem, clear understanding of people, have like solid like operations in place as well to be able to scale the problem. And so I advise organizations on like how to do that. And I offer consulting services, one-on-one coaching, workshops, and other training. And I also offer kind of a free like quiz or audit that people can take
Mm-hmm.
so that they can do an initial assessment of like their what I'm calling innovation readiness. Like, how ready is your product or idea really to like disrupt the market or provide a good solution that people will be excited about? And then on the other side of that, I'm also building a tech platform that is utilizing blockchain and AI
Oh.
to really make it accessible for organizations to deeply engage with patients in designing their product. And I right now really want to help early stage startups to accelerate their time to product market fit.
Mm-hmm.
Now we have a lot of healthcare startups that fail. 98% of them actually fail. What makes it hard in I think the healthcare space is we really need innovation. One, two, it's one of the highest areas that we invest in. It's the fifth highest sector to receive investments globally, right? So when healthcare startups and innovation fail, to me, it is a huge waste of resources and actually quite harmful because there are people that definitely need help and should be getting help, but the solutions that we're putting out there are not, scalable and really impactful. So my platform is really intended to help startups in that early stage of product development to really think deeply about the problem that they're solving, really deeply engage with patients, and it's really done through both stories and data. So we know the power of data. We know the power of looking at data by demographics, for example, and understanding like what's happening at that level. But data by itself is very flat and incomplete. Without the context,
Mm-hmm.
right, you're missing a whole lot. So let's say there's a startup that wants to engage with patients with diabetes, right? So you can look at the data and be like, oh, we have this many patients that were diagnosed pre-diabetic, were diagnosed when they had full-on diabetes. But it's different if you understand that the person got diagnosed because they were walking to work and all of a sudden their vision was blurry and then they fell and hit the sidewalk. That's a very different experience than someone who is regularly going to the doctor and getting checkups and then notice that their A1C levels were creeping up. How do you serve those two different people? So without that context and the story of their experience, you really miss out on developing deeply engaging and enriching solution for those populations. And my platform is intended to make that very simple to do.
And that are you talking about the Compass project? Is that the one that you're talking
Compass
about?
Project.
Compass
Yes.
project.
Yes.
Now, tell me about this AI and blockchain. So AI, I guess there's more literacy now about AI in general, but blockchain and specifically, what is that?
So, blockchain is essentially decentralized data, right? And it's probably one of the most secure ways that we can
Mm.
store and access data. And for me, the blockchain element comes into how patient stories and data are being collected. I strongly believe that the healthcare industry hoards data and are incentivized to do that. And I think that data should really be owned by the people who generate the data, which are
Mm.
the patients.
Okay, we're talking. Now we're talking.
Right. So for patients to own their data, though, they need the tools and mechanisms to do that. And blockchain is definitely one of the best out there. And with blockchain, patients can control how their data is being accessed, consent on who can access it. And what I also think is important is patients should be compensated on their data and information, because if it's being used to make decisions that are leading to revenue,
Mm.
then why aren't patients being compensated for it?
And blockchain gives that
Right.
infrastructure. I
Yes.
had an obsession with blockchain a year ago where when I found out about it and did all this research. So when I remember when you had pitched I was like, oh, I got someone who knows something about blockchain. This is perfect because another thing that comes up is innovation widens the disparities. It gives more to the haves, it takes from the have-nots. What's your reaction to that? That AI is just going to widen that health gap. That's kind of the common belief in a lot of people about not just AI, but innovations in general.
Yeah, that is a common belief.
Mm-hmm.
And my response to that is it depends on the kind of innovation. I think innovation as we generally know it generally is technological innovation, right? When the car was invented, people were using horse and buggy. It was a completely different way of moving around.
Mm-hmm.
No one knew they needed a car until a car was invented, right? When the cell phone was created, we had phones at home and dial up and pay phones. When it came out, it was like, oh, look at that. It's wireless. I could take it with me. People didn't exactly know that's what they needed, but then now everyone has a cell phone, right? Same thing for like platforms like Facebook, social media, and other things. But when it comes to healthcare, which I think falls under social innovation,
Mm-hmm.
generally people know what they need. People are experts in solving their own problems if they're given the right tools,
Mm-hmm.
if they're given the right resources and supports and education, right? So I think when it comes to social innovation, especially when you're integrating that with technology, people do need to be at the center of
Mm-hmm.
that because I am my own expert in my own lived experience. Someone who has had diabetes for 10 years, right?
Mm-hmm.
They know their body, they know their symptoms, they know what works for them, they know what doesn't, right? And that is a wealth of knowledge and information that can drive innovation. And that's what I think the difference is. And that's why I think also when we apply this technological innovation framework to social innovation,
Mm-hmm.
we end up with these huge disparities.
I was seeing a term that you used a lot was sort of analyzing social determinants of health narratives at scale. And obviously that has something to do with AI and using that kind of technological innovations. But what do you mean by that, and how does that help advance health equity?
Yeah, so when we talk about putting people and patients at the center
Mm-hmm.
of innovation, it's really about deeply understanding their story, right? But it costs a lot of time
Mm-hmm.
and effort to go to every individual patient and be like, okay, tell me about your
Right,
experience
right.
with diabetes or tell me about your experience with cancer.
Mm-hmm.
And oftentimes, even like the way that you engage with patients around asking those questions, depending on their level of trust or comfort, they might not be willing to have that conversation. You know, there's all of these factors involved. And traditionally, what happens, and this was actually work that I did again in that first role I was telling you about, where we were interviewing people living with HIV and AIDS who were adhering to their medications. And we were trying to find out from them, like, what are you doing that's helping you? So it was literally like talking to people, transcribing the conversation, and then going through and highlighting things that they were saying and looking for patterns
Mm-hmm.
across 20, 30, 40, 50 people.
That's right.
That took us months to do.
Gotcha. Gotcha.
Months. With AI, seconds,
Oh.
right? So I think it makes the aspect of storytelling and contextualizing data much more feasible.
Okay. Okay. Now, I'm assuming this ties. The other term I've seen you use is social listening. Is that kind of a parallel explanation of what happens as part of that process too?
Yes, social listening or patient engagement is it's really being able to directly engage with people and ask them about their stories and lived experience.
Mm.
And I think it also needs to be an ongoing conversation, not something that we do one time, collect information, and we walk away because our experience of our health is very dynamic.
Mm-hmm.
Right. And it changes from day to day or week to week. So it's like creating a mechanism to consistently hear, like, what people's stories and their experiences are so that you have the freshest perspective. One of the, you know, one of the inadequacies when we think about data
Mm-hmm.
and what we also have in healthcare innovation and even in the pharmaceutical innovation space, we're using very old and outdated claims data, for example, which
Okay.
is very biased, very incomplete, right? But we lean very heavily on those things because that feels like the best we have, right? But now I think we're definitely in a time where, especially when we know the power of AI, but AI feeds on data, we can develop very rich and real time data sets by making this like social listening or patient engagement, feature much more accessible.
Okay, okay. And I'm still coming back to the blockchain and how disruptive it is for data ownership and control, and then having patients and people tell their stories be compensated for any profit that's ultimately made from innovations that come from it and stuff. And that's kind of one thing I'll take away. But I'm going to turn it over to you to, if you could, you have a very deep understanding of how the healthcare sector is evolving and where investments are going. What do you see as future trends in terms of where innovation is heading? Like, you're obviously being a disruptor with your new platform here, the Compass Project, as well as your LLC. Where are we shifting now? Obviously, AI is a big enabler of that. Are there any opportunities that even future people who might be looking to become an innovator might be able to exploit that ultimately benefits patients and communities? Do you see an area there that people might be able to look into?
Yeah, I think healthcare is still a lot of the basic things that need
EMR?
innovation, for example. Yes.
That's
Let's be
like
very
the
clear. Yes.
oldest problem ever.
Yeah, or even when you look at, some of the major EMR systems and like the patient portals, those things are not easy to navigate and they're not intuitive, right? Like I was helping someone navigate a patient portal and they were like, I have no idea where to find my MRN. I really don't know. And like, I need that for, scheduling appointments and other things. Like, that shouldn't be that hard, you know? MRN meaning like your medical record number. So I think it's still in those very, like, we still need innovation, even in terms of like making it very easy for patients to like access appointments and schedule times with doctors. There's definitely platforms out there like ZocDoc and others that are online and functioning, but it's not ubiquitous and very widespread still, right? Um, I think healthcare education is ripe for innovation. When you think about the years of investment and dollars in terms of loans and debt that physicians and nurses and other healthcare professionals are having to take on, it is a huge deterrent for people who don't want to walk away from, medical school or nursing school with hundreds of thousands of dollars of debt, right? So, how can we innovate healthcare education so it's much less expensive so people who are called to this work, right, can go in and do it without thinking about, am I going to be able to afford a house? Right? So, I think it's still, there's so much in healthcare that needs innovation. And I think I would encourage people to lean away from coming up with fancy gadgets and other things. Like, those are fun. Like, I wear an Aura ring. Like, I love gadgets. I work out in VR. Like, I love technology. Like, I'm
Right.
all in, right? But some of this innovation is really just like, let's make the basic things better. Let's make it easier to just be good humans and provide good care.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.